My name is Jane Barratt, and I'm a global expert in ageing, health systems, and social policy. My hopes for the World Federation of Public Health 18th World Congress is momentum, because the world doesn't need more diagnosis. It needs the courage to act. And I hope that this Congress becomes the moment when we stop admiring the problems and really start accelerating solutions. The World Federation is well positioned to bring partners across sectors and across disciplines together to develop consensus statements and actions going forward. When I return from this event, change means going home with new alliances, not just new ideas, because ideas don't necessarily move into actions. So meaningful relationships that really help us shift policy, strengthen systems, and build equity into everyday practice. As a person who really believes in attending this important Congress, the biggest global shift that I will observe is recognising that health systems must serve people across the life course, not disease silos. And going to South Africa, we have a unique opportunity to understand the life course perspective from different geographical locations. What are the people in South Africa and the African region really saying to us as delegates in this Congress? In South Africa, I expect a much deeper push and holding us to account on equity and climate-driven vulnerability. The gap between health without borders and reality is visible everywhere if we really wanted to look. But most importantly, we see it in data access, workforce mobility, and inequitable financing. Progress is strongest where cities and communities lead. The local meets the global, innovating faster than national systems. So we talk about bottom up and top down. We must really pay attention, to the local to global direction. My personal learning goal at this Congress is to learn how global colleagues are building resilience into systems when they're being strained by demographic change, climate and chronic disease all at the same time. So we must understand, the drivers to improve health system resilience and also drive down chronic diseases across the life course. If I had the microphone for the final keynote, the words that I would use are bravery, courageous, and accountability. We need to stop treating equity as aspirational and start treating it as a requirement, an essential part of who we are as individuals and the collective community. No health system is sustainable if it leaves people of any age behind. My final remark goes to each and every delegate who attends this conference. We have an innate responsibility, not only to our colleagues, but to the people that we serve in all of our sectors and all of the disciplines that we work in. We can no longer work and live in silos. We have a responsibility to be the connectors across disciplines and across sectors so that we can be formidable voices for all of those that we serve in the community.